Gurmagat Cahirlook and Fáilte and Sean you. Bernard, I just want to start off with a question. Do you believe that you have control as CEO of the organisation?
I believe I do have control of the organisation, but I believe there are weaknesses in the control systems because it's such a distributed organisation. I don't mean that.
Yeah, no, you're okay. Yeah. I'm going to start off by complimenting you. I actually have a copy of your memo here that was sent out, where you identified 30 million euros a year being spent on postage, and when I heard about this and I heard about your efforts to try and reduce that spend, I was concerned. I said, surely, maybe it hasn't gone out clearly or the message hasn't gone out. But in fairness, I can see from your memo, it's very clear that any individual that can be moved to an SMS or email, you said to do that, right? How has that gone?
It's a slow burner, there's no doubt. Individual hospitals and sites are telling me they just don't have either the technical capability to immediately switch to SMS. Chief Technology Officer is here, he'll be able to talk to that further if you wish. So we are assisting the system in doing that. So I would say it's very slow. I'm told that
So what system do you have in place at the moment? If a patient is in the hospital and there's a doctor working with them, how do you get that person to move from getting letters to an SMS? And is that system available to every hospital?
I might just ask the Chief Technology Officer to answer that. It's different in every hospital, sorry.
There's multiple patient administration systems in the hospital, which is one of the issues, but we are deploying a single system across the country in advance of the electronic health record, and that's fairly well advanced now. Probably I'd say about 75% of our hospitals are on that system. So we have hospitals like Beaumont, I know we're with you, their system is 35 years old. They've just upgraded 2 weekends ago. So what we've done is we've put in a standard two-way texting system, under pressure on time, but which will integrate in with the system so there's no manual intervention in the middle. I'd say about 20 of the hospitals are on that, and the plan is to extend it out from there.
Sorry, you're the REO for the Dublin area, right? So how is it going in your hospitals? Have you tried to roll this out and implement it?
Yes, we have, and I would say it's a mixed picture across the hospitals, and I think, as Damien has said, that depends on the systems they've been on, but it's certainly where we're going, and I think it's also a
So if I was to ask, out of every patient that comes through the hospital every day, what percentage do you think are being asked for their SMS and email contact details?
I wouldn't have a percentage to be able to give you.
Do you think any patients are being asked?
Yes, I think they are, yes, and I think it will depend on what hospital they visit.
The point I'm making is the feedback I've received is that this isn't happening, is that the postage costs aren't going down. And there's 30 million euros being sent out in postage a year in reminder for an appointment. Here's your account statement. Here's this thing. So you're sending out 30 million worth of postage a year. And I think you were right to identify that cost has to be brought down. But I just want to know what percentage has it been brought down.
And I think it's fair to say to you, Deputy, I think I issued that control earlier this year. It is a slow burner. What the system tells me is, as we move now to single patient administration systems on our way to electronic health record, it's probably going to take between 18 months and 24 months to achieve a substantial reduction. The principal point of the direction I've given is the system now has to progress that direction and achieve that. And
I appreciate that, and I do wish you well with the implementation of that. But I just think ye should mandate that every single patient that walks through your door, the first thing you capture is that piece of data. Because when they come through your door, that's when you have it. Then you never have to send that person a letter again. And I accept there will be elderly people out there who post is the only way of communication. I accept that there will always be a percentage of that. But ye should be relentless in reducing this cost. I'm going to move on to my next point, right? So I guess what's really interesting is from the Statement of Revenue, Income and Expenditure between 2019 and 2024, total expenditure rose from 17.2 billion in 2019 to 26.9 billion in 2024. So that's an increase of nearly 10 billion in 5 years. Within that, right, your non-pay spend went from 11.2 billion to 17.6 billion. So that's an increase of over 6 billion. Am I right with those figures?
Correct, that's it. The total figures are correct. I'll check the non-pay figures for you.
Okay. So I find it interesting that the CFO says he'll have to check the non-pay figures, because when I sum up that non-pay spend, that's about 89 billion across 6 years, and that's where procurement sits, correct?
Yes, Deputy, but a large part of the non-pay spend is spend going out to voluntary organisations. That's about 7 billion a year of the current 24 billion, and the primary care reimbursement service, which is another 4.5–5 billion. They're not They're
Yeah.
not procured in that context.
So-
the
so-
procurable spend is more like 4.5, 5 billion.
Yeah. Well, I know you have 7 billion going to outside agencies, but I'll come to that later. Given the level of non-pay spend, can you explain how you monitor and manage it?
So Deputy, we have a devolved budgeting system, so every manager gets a budget, starting from the CEO right down to the senior leadership team out to the regions. That comprises of both pay, non-paying income. It's set annually in line with the estimates process and the National Service Plan, and then monthly it's monitored against actual spend is monitored against target. It's divided between clinical, non-clinical, and other operational expenditure.
So you're dependent on each manager, each organiser, each hospital to stay within the budget they're given.
Performance managing deputy, so the regions and the other national directors performance manage the budget management of their staff, and effectively, as I said, we now have much better central visibility, and it's improving further with the single IFMS national financial system that we have. So it's closely monitored on an ongoing basis.
Okay, well, you see, I don't believe it's closely monitored. And the reason I say that is because I've asked parliamentary questions where I've asked how many tenders came in, on or over budget, and you weren't able to tell me. Do you have oversight of all tenders within the organisation? And do you have a contract management system for managing that?
So not as yet, Deputy. That's part of one of the benefits that we will deliver with IFMS, and it depends on which type of tender that you're talking about.
Yeah. But at the moment, you can't track performance at the contract level.
Well, no, Deputy. So if you talk about tenders for ICT projects, we can absolutely track them. They are tracked. If you talk about tenders for large construction projects, they can absolutely be tracked. And they're two of the largest types of projects. There's huge controls over those and ongoing monitoring and performance management around those. So we absolutely can track all of those. A lot of the other tenders we're talking about are tenders for the purchase of consumables, where we estimate the value that's being purchased, and then we make that contract available and people buy off it. The control is whether they're operating within their budgets or not. And in some cases, people will go over budgets, and that's a matter to be dealt with through the accountability and the performance management process. But in the context of big contracts for systems or buildings or other projects, yes, we do have dealt with through the accountability and the performance management process. But in the context of big contracts for systems or buildings or other projects, yes, we do have visibility.
So just right. So in terms of spend, right, and non-compliant procurement. So I just want to define non-compliant procurement is essentially where the rules aren't followed for procurement. Is that correct?
Yes, essentially where the EU public procurement rules, which are designed to ensure value and transparency, and are necessarily
so
complex.
You do a self-assessment of your procurement where. And in 2024, you reviewed 29,012 invoices above 25,000 euros. Is that correct?
That's correct, definitely.
Do you have any checks in place for consistent invoices coming in at, say, 24,000 or 23,000? Do you have any checks for any anomalies like that?
So we have financial regulations, Deputy, that require people not to what's called split purchases to try to avoid any of the various controls, including that 25,000 euro threshold. But the reality is, in advance of IFMS, we haven't had a single system, and we haven't had the capacity to actually monitor non-pay purchase orders at the level which we want.
Stephen, do you believe that there are companies out there that are invoicing the HSE less than 25,000 so they go under the radar?
No, Deputy, it's not in their interest. The risk is that people, in determining whether they need to go to a particular type of procurement process, are estimating that a need would be lower than the threshold, typically.
But it is in their interest if they weren't properly procured.
Not in terms of invoicing, Deputy.
But if they were non-compliant in their procurement and then they come in under that amount.
No, Deputy, that's a matter for the organisation, not for the supplier. Once we've ordered something from the supplier will deliver the product, they will invoice for the product, and if we've received the product we've ordered, we'll pay for it. You're
right in that it is a matter for the organisation. But if the individual in the organisation is a related party or connected to any of these companies, it is in their interest to go under the radar.
I think, Deputy, if it's a related party, there's a whole list of possible conflicts. But if I could just say, Deputy, fundamentally, where...
I know there's a whole list of conflicts, but you don't have a register of declarable interests.
We do, Deputy. People have a requirement to fill out an annual statement, an annual SIPO declaration.
Okay, so we had Beaumont Hospital here last week, and they confirmed to me that 25% of their consultants haven't complied with their SIPO obligations. Do you have an idea of what the compliance rate is across the HSE?
It's definitely improved since last year. It's in the 65, I think 66%.
So 33% of people in the HSE who have a SIPO obligation haven't complied with it. I mean, if we as public representatives didn't comply with our SIPO obligation to declare our interests, so 1 in 3, if I walk into the HSE today, 1 in 3 people haven't bothered filling out the form.
So definitely, it's an area which we are improving on, and yes, we accept it is an issue.
What are you doing to improve that?
Every year, deputy, it has increased in the last 3 years. One of the colleagues will probably have the actual figures, and there's a concerted effort between our communications team and our HR team in order to drive up compliance and maximise that compliance. And as I said, it's up from, I think, mid-50s last year to 63-64% this year. But you're absolutely right, it needs to be driven to 1%.
I think that is scandalous, because if 1 in 3 people in the HSE aren't doing their SIPO obligations, then that means they could potentially have a declarable interest or a conflict of interest of which they are not declaring, and hence why I'm trying to say that non-compliant procurement, which I think accounted for over 9% of your procurement spend, am I correct in saying that?
That's correct.
Yeah, so 9% of your procurement spend, and your procurement spend is massive and has ballooned in the last 3 to 4 years. Would you agree your procurement spend has ballooned?
I would agree, Deputy, that the state has made a very significant investment and continues to make a very significant investment in the delivery of services, and that involves pay and non-pay expenditure. And just to say, Deputy, the CNAG is correct. The self-assessment exercise, which is a manual retrospective self-assessment exercise and will be replaced in time by the IFMS system, only looks
just on the IFMS,
over €25,000.
Just on the IFMS, right?
Yes,
I apologise, I keep cutting across you, but I'm passionate about this and I want to see results, right? The IFMS, are there people in the HSE who are frustrating the IFMS being implemented because they don't want to see it implemented because they're happy with the way things are?
No, Deputy, I wouldn't believe so. Change is difficult. There will always be people struggle with change. But the IFMS system is now rolled out to 100% of the HSE's directly run services since the 1st of July.
I think it's fair to say, Deputy, just to assist with that, and again, to be totally upfront, and I've seen lots of systems implemented. IFMS is, like a lot of systems, SAP based. It's a rules based system. You can't go around the rules. Yep. And we're not an organisation traditionally given to nationwide of following the same rule set all the time. That's part of the culture change of the organisation. There's no point in me telling you anything different.
Yeah. So just on the...
Could we just say, we've gone from a situation where all of the invoices arrived in various places around the entire HSE. Every invoice now arrives into one central place and goes through now a single central process. They're rejected if they don't have purchase orders. So we are making the business practice changes that IFMS enables.
It's really important.
But there's a number of years' work.
I want to thank you for publishing all of your purchase orders over 100,000 on one machine-readable format. That was very useful and helpful. And can you just confirm that once the IFMS is fully integrated, purchase orders over 20,000 will be published for the whole of the HSE?
Our aim is to publish purchase orders over 20,000 from either Q4 this year, Q1 next year.
Yeah, that was confirmed to me in a parliamentary question. I appreciate that. Yeah. The other thing then I wanted to talk about, you spoke about this provider who provided €15 million worth of goods to the HSE. Mm-hmm. Somebody paid out those invoices without confirming that the stock was received.
That's right.
Have they lost their job?
A number of the people who were involved in signing off various aspects of that are no longer in the organisation. So it's.
Did they leave off their own?
No, they've left of their own volition. Yeah, absolutely. This issue came to light last Christmas. So the only reason really I became aware of this was a story in the newspaper where the company were claiming that it was the HSE's fault that they were heading into liquidation. And obviously when I inquired into it, it was anything but the HSE's fault that they were heading into liquidation, and that's why the loss is not recoverable.
So you reckon you've lost 5 to 7 million on this, and the people who paid out the invoices have just walked away from the HSE? Is there any ongoing investigation into that?
The advice I have is that it's not recoverable, and the advice I have is that the key people who were central to the decision-making process are in the main not available now for investigation. That will make the investigation...
When you say not available, do you mean they've left the country?
If they don't work for us, they're not available. I have no jurisdiction to investigate anybody who no longer works for us. So that's the truth of it. I don't have any compellability for investigation whatsoever. And the reality is, and again, whether we like this or not, and again, just to be absolutely clear with you, This occurred, obviously, I'm looking back retrospectively, I wasn't here at the time, but this occurred during COVID. It occurred in a period when there was very high demand for fast-moving, agile, various other phrases to use. Most controls were either relaxed or set aside to some degree. And what you find when you do go to look back in a situation like this and you do question someone is there's suddenly 25 people, 30 people, 35 people who are all cited at different levels in different ways, and it simply is impossible to get to a level of accountability on that. And that is a huge regret, because I'm a huge believer in accountability. People did fail in their job here. People failed in their duty regardless of COVID.
There isn't 25 or 30 people that have left, though.
No, but in fairness, what you have to do in a situation like that is you have to look and say, what were the more senior levels of the decision making?
Just a last point, Bernard. One of the biggest frustrations the public have is the accountability piece, and we try to achieve that here.
Yes.
But the problem is that you're after telling me that the 15 million was paid to the company. The person who approved the payments has left the HSE. They're not available. I mean, the public will not accept that.
Well, it wasn't one person, so just to be clear on that. But I do want to say to you on the question of accountability, because I think it is important. I'm a firm believer in it. I think I've said in committees, I got into difficulty earlier this year for being so bold as to suggest that I'd make a referral to the Gardaí about a matter I was concerned about, and I did. In a completely unrelated matter, I have pursued one of the highest levels of accountability and disciplinary investigation against senior officials, which is ongoing. I don't have any fear of accountability, but I equally have to be honest with this committee and with my board when I say I believe that something is exhausted, and if it's exhausted, it's very difficult when all of the players are not available.